Welcome to the ENT clinic at Sengkang General Hospital. Your visit begins at the registration counter or at the self-registration kiosk. Once you have registered, take a seat and wait for your number to be called. After you have taken a seat, the doctor will discuss your ear, nose or throat concerns with you before moving on to the examination. For nose and throat issues, the patient undergoes a flexible nasal endoscopy examination. The procedure is quick and straightforward, typically lasting just a few minutes. A small camera is gently inserted into the nostril. This is done to evaluate any potential swelling or abnormalities inside the nasal or throat regions, including the back of the nose. Additionally, it can aid in the detection of voice irregularities. To begin, a decongestant and numbing medication is applied into the nose. Due to the connection between the nose and throat, some medication may enter the throat, resulting in a lingering bitter taste for approximately 60 minutes. Once the medication has taken effect, a small camera is gently inserted through one nostril. Breathe normally. The doctor observes the live video feed on the monitor and captures relevant images of any findings. The camera is then maneuvered to the back of the nose and downwards to assess the vocal cords and throat. It's important to note that the nasal endoscopy procedure typically examines only up to the level of the throat and does not extend into your esophagus. After the procedure, we recommend avoiding eating or drinking, especially hot items, for at least an hour, while the effect of the sprayed medication persists. Subsequently, any issues identified during the procedure will be discussed with you by the doctor. Another frequent concern among patients pertains to ear issues. Examples of these concerns include blocked ears, earwax, or ear discharge. In these cases, an examination of the ear is conducted under a microscope. The microscope allows for a significantly enhanced view of the ear, facilitating the easy removal of impacted wax or debris. The patient is positioned in an upright manner in the examining chair, or in some instances, a lying position may be adopted. The doctor will observe through the microscope and use various instruments for ear cleaning. Typically, a suction machine is utilized to remove debris or fluid causing obstruction within the ear. Occasionally, alternative instruments may be employed. The suction machine may produce a loud noise within your ear. There's no need for concern, as it is solely aiding in the cleaning process. If you experience any discomfort or pain during the procedure, alert the doctor immediately and avoid making any sudden movements. In rare cases, patients may encounter some dizziness or experience coughing during or after the procedure. For patients who experience problems with dizziness, the balance mechanism inside the ear may be affected. This will be assessed through a series of tests. Some basic tests include checking eye movements and the gentle shaking of your head. Other tests include walking or balancing with your eyes closed. Our clinic assistant will be by your side to ensure your safety in case you experience dizziness or a loss of balance. An alternative test involves a rapid turning of the head to one side, followed by lying down with the head slightly angled downwards. You are required to keep your eyes open and maintain focus on a distant point while the doctor assesses your eyes. Some of these tests may cause the dizziness to worsen temporarily. If the dizziness is persistent, or if the patient is unable to tolerate them, some tests may not be performed. The doctor will then discuss the findings and explain ear-related balance disorders to you. Our ENT clinic staff and doctors are dedicated to putting your well-being first. We hope that you will have a comfortable and positive ENT consultation and examination with us.